My topic today is not about a disease. It is about a simple condition that can be sometimes associated with different illnesses. Yet, it is very disturbing and annoying to some patients. It can reach a point that some patients might get obsessed about it. It is called constipation. My name is Dr. Amir, and welcome back to my YouTube channel. There is no normal pattern for bowel movement. It varies from one person to another. Someone can get 3 bowel movements per day, but another one can go every other day. They are all normal if there are no other symptoms. What are the symptoms? Normally, patients complain of straining and hard stool. Sometimes, if it is associated with IBS or irritable bowel syndrome, they complain of bloating and abdominal pain with it. Other patients might get a feeling of incomplete stool evacuation. In general, they usually have less than 3 bowel movements per week. It is normal if someone gets constipation occasionally, and there is no need to get concerned about it. But if the prior symptoms are present continuously over 6 months, then it will be called chronic constipation. IBS is the most common cause for constipation. Another cause is the lazy colon, which means slow stool movement in the colon. This can be related to lack of fluids or exercise, or could be related to your diet, especially not eating foods which are high in fiber. Of course, there are other conditions which can cause constipation, like underactive thyroid or Parkinson's disease. Also, it can happen after using certain medications like calcium, iron, or narcotic pain medications. Some patients can have constipation if they have bad hemorrhoids or anal fissure. Usually, they try to avoid bowel movement because it is extremely painful. On the other hand, and strange enough, chronic constipation can also cause hemorrhoids and anal fissure as well as a complication. Another rare cause for constipation, especially in adults over 50 years old, is the presence of a narrowing inside the colon, which sometimes might be due to a colon cancer. So it is very important to consult your doctor for any new or chronic constipation. In general, it is much easier to prevent constipation than to treat it. Some of the tips to prevent constipation are to increase fiber intake in the diet by eating whole grains, fresh fruits and salads, or taking fiber as a medication. Also, you should do regular exercise, drink lots of water, and try not to delay going to the bathroom when you have to. Also, try to maintain your routine scheduled bowel habit. What about the treatment? Of course, the best position for sitting on the toilet is to raise your feet on a stool and try to get your knees closer to your chest, almost similar to the delivery position. Another option is squatting. For the treatment, the first step is to use fiber supplement, then stool softener. If there is no improvement, we can try different types of laxative, but it should only be for a short period and not on a regular basis. Otherwise, the colon will get used to it, and it can be harmful in the long term. Finally, there are some new medications which can target the lazy muscles in the colon in patients with chronic constipation to improve the slow movement in the colon. I hope you enjoyed my topic today. If you do, please like, share, and subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.